Hi, everyone, and welcome to today's episode of Public Health in Real Life. Today, we are covering an important topic, and that is patient safety. So, tomorrow, September 17th, marks the World Patient Safety Day. So, why is patient safety important? So, if we look at the WHO definition of patient safety, they define it as a healthcare discipline that emerged with the evolving complexity in healthcare systems, and resulting rise of patient harm in healthcare facilities. So it aims to prevent and reduce risks, errors, and harm that occur to patients during the provision of healthcare. A cornerstone of this discipline is continuous improvement based on learning from errors and adverse events. So, who's responsible for patient safety? So, the WHO says that everyone, it begins from the healthcare worker to patients to families to caregivers to the community to government. So, everyone is involved and needs to be committed to patient safety, and that's the day we are celebrating tomorrow. And it calls for global solidarity and concerted action by all countries across the globe and international partners to improve patient safety. So I will turn it over to Chris at this time. Hey, Chris, welcome to the program. And can you go a little bit deeper into this year's theme for World Patient Safety Day?
Thank you, Ashwin. Hello, everyone. Medication safety has been selected as a theme for World Patient Safety Day 2022. Medications are the most widely used health intervention in healthcare, and medication related harm constitutes the greatest proportion of total related harm due to unsafe care. So, acknowledging the substantial burden and recognizing the complexities in medication related harm prevention and reduction. So, this year, medication safety has been selected as a theme for World Patient Safety Day.
Thank you, Chris. Agreed. So, medication harm accounts for 50% of overall preventable harm in medical care, and over $42 billion of global total health expenditures worldwide can be avoided if medication errors are prevented. So, that's a big number. And to discuss more about it, today we have Michael Egharevba. Uh, Hi, Michael. Welcome to the program. So, Michael is a pharmacist with over 10 years of experience in international public health, many years in health humanitarian services as well. So, he is both licensed here in the US as well as in Nigeria as a pharmacist. He has vast experience in program management, system design, implementation, monitoring, and evaluation of public health programs, which includes a diverse range of public health topics, including essential medicines, HIV, AIDS, malaria, tuberculosis, and maternal health and neonatal child health. So, other areas of strength of Michael include good manufacturing practices and capacity building. He is an experienced public health professional and a supply chain professional as well, with excellent technical management skills. He's experienced with working with diverse teams, developing strategy, and interpreting complex data for innovative solutions. So, Michael, we are very glad to have you. You bring extensive experience from diverse areas, and it talks about the range of topics you can talk about in terms of patient safety. So, welcome to the program.
Oh, thank you, Ashwin, and thank you, Chris, for having me.
Welcome, Michael.
So, Michael, so medication safety has been selected as the theme for World Patient Safety Day 2022. Why is medication safety important at this time in the world more than ever?
Okay, that is a good question. Let me jump and continue from where Chris and Ashwin, stop. You guys acknowledge that many people around the globe today. They're taking one form of medication or the other for one health condition or the other. These medicines are meant to cure our sickness or manage our sickness. But when medicines are now hurting people due to some form of medication error and adverse reaction, then there is an issue. So basically, medication safety is a concern today because of two reasons that I see. The first is that it causes harm to people. Medication error and adverse medicine reaction is causing harm to humanity. Uh, as you know, many medicines in the world today have been consumed. So just imagine as we speak, how many people are swallowing one medicine or the other now as we speak. And the number is increasing, it's still rising because new medicines are being discovered uh, as diseases, come to our shores of human beings. One way to fight those diseases is actually to come up with new medicines. A good example is the COVID-19. We have a race of medicines for them now. Uh, so with new medicines coming on board, and even old medicines are finding new uses, right, in today's medicine. So the implication is that more people are taking medicines. Um, Unfortunately, some countries have statistics to show for this, while others do not have. For example, according to CDC, 82% of Americans, this is a country that have information and data to show, 82% of American adults takes at least one medication, and 29% of that take five or more. This is CDC, statistics from CDC. And adverse drug events in that number is causing people to come to the emergency department, and that number is 1.3 million emergencies visit per year. Out of that, 350,000 hospitalization each year. Again, this is a country that has record, and it's public. Everyone can see it. And again, this is a country that has a system in place uh, for you to get prescription medicine. You have to go through the system. What about countries that does not have those kind of system in place that everybody have access to prescription medicines? So the number and the challenge we have at hand collectively is actually more than the statistics you see globally. Um, what about countries, without record at all, as I said earlier on? So because of that, it is becoming an issue that should be taken seriously, and that's why the importance. The second reason is the economic cost. Well, we can want to call it loss at this time to nation and the world. In America, according to CDC, 3.5 billion is spent on excess medical costs arising from adverse drug reaction annually. Uh, to write on what Ashwin just mentioned, looking at it from the global stage, WHO says this is 42 billion annually, representing almost 1% of the total global health expenditure. So it is a challenge to everyone, a challenge to you, a challenge to me, and every other person around the globe. So that's why it is becoming increasingly important to talk about uh, medication safety.
Thank you, Michael. So this is a very informative answer. So you discussed about the medication practice across different countries. So your follow-up with the previous question, can you please distinguish the harms we see in developed versus developing countries?
Okay, that's also another interesting question. I would say that the harm depend on the medicine in use and mostly prescribed in any country. And the medicine in use, mostly prescribed, is a function of the prevailing medical condition. Whether in developed country or developing country, there are some medical conditions that cut across both. But with respect to um, medications that are mostly prescribed and used, you can see from developed countries, you could see something like antihypertensives, uh, medication for controlling cholesterol. And these are information you could see if you just go online. You see first 10, first 20, first 30, first 50 medications that are used in countries. Um, so in the US, for example, I mentioned antihypertensives, medicine for controlling cholesterol, medicine for controlling diabetes, medicine for controlling asthma, antithyroid medication, ulcer medication, pain medication containing opioid, and many more. But if you look at the developing country, yes, these medications are equally used, but from my experience, the ones that are mostly used, we have pain medicines. The non-steroidal anti-inflammatory agent is mostly used. Antibiotics, antihypertensives, even multivitamins. In some countries, you see, developing countries, you see multivitamins is in every prescription that goes out from a particular health facility. And the harm, that these medicines cause can be looked at in different ways, right? There are harms from medicine use itself. A good example is for control of hypertension, right? Or control of blood pressure. If the use is, compromised, or there's medication error, the blood pressure is remain uncontrolled, and for a long time, it could lead to stroke, heart attack, or other health condition, and it could even lead to death. We've seen that when patients are rushed to the hospital, if the gadgets are not there to resuscitate that individual from the heart attack, the person is gone. Talking about antibiotics in the developing world, um, you could have worsened infection and bacterial resistance to antibiotics. That is also common. Um, Looking at the developed society, most times for pains, we see this in prescriptions. That it always has anti, pain drugs, but those drugs are, they have opioid, and that leads to addiction over time. Um, so also in developing countries, another thing we have to consider is that patients there, or citizens there, they have alternative access to some other medications, mostly herbal. They do not disclose this to health workers, and these are harmful practice. In the long run, it affects their health when they administer it with prescribed medicines. Harm from poor storage of medicines. I have visited quite a few countries, and I have seen the medical stores, whether at the central level, the intermediary level, and at the facility level. Storage of medicine is very important. Storage is meant to keep the integrity or the potency of any medicine. But when the storage is compromised, the storage condition is compromised, before the medicine even gets to the end user, you know, um, the efficacy would have been, gone. And then you wonder what the person is taking at that point in time. If I'm to give any story, I have a little experience with this. So I was practicing as pharmacist in a general hospital in a country, and I was on call that day. Oxytocin was prescribed from the labor ward. I sent oxytocin down there, one ampoule. Not quite long, they asked for a second ampoule. I gave the second ampoule. At that point in time, I became worried. I knew something was wrong. They came third time again to ask for oxytocin. By this time, I asked the husband to the patient that's in the ward to go across the road to go get oxytocin from a pharmacy, because I kind of trust the storage condition in that pharmacy compared to the public hospital that I was. And that saved the day. Oxytocin was bought from that hospital, from that pharmacy, taken to the the ward, and then that saves the day. So that,
That's a big deal.
yeah, it's a big deal. There are legal issues too, right? In the developed world, right, when a medication error is tracked and recorded, and a patient can actually sue the health worker, he can sue the health institution, and that can result to some harmful penalty, you know, on the part of the health worker and as well as the health institution. So, by and large, the harms, they are much, and I can just continue on and on and on.
Michael, that was definitely a quite a great distinguishing between the developed countries and developing countries. And we know you're expert in supply chain management. And if we go all the way in the supply chain management to the manufacturing of the products, uh, we have organizations like Quamet around the globe that go and they vet different organizations and companies and nations on the quality of medicines being manufactured and shipped. And one of the reports they had published showed that um, medicines manufactured mostly in developing countries like India, China, Vietnam, Philippines, all these countries, they have three different quality standards. One is for their own population, one for United States, Canada, developed country, and one standard for African countries and other poor nations. Now, how can we implement, or who should implement those findings and make a change in the societies? Would it be something that originates from the nations that import the medicines, or should it be something that the global multilateral organizations like United Nations, where should the change needs to be originated?
Thank you. Um, of course, today, um, an issue can start from one part of the globe, and before you know it, it
Yeah,
goes around everywhere. And we have seen that happening when it comes to the COVID-19. We saw that, and we have seen that even when it comes to some political issues and all that. So we are all involved. The driving factor for all this is actually finance, financial gains, right? Medicines are made to take care of diseases. Diseases can rear up their head in any part of the globe. Now, what is the rationale for making a good example, amlodipine, which is an antihypertensive? What is the rationale for making amlodipine 5 milligram or 10 milligram, as the case may be, right? Of different quality, of different quality, right? And the yardstick for separating them for different countries is actually quality issues.
yeah,
And when it talked about quality, the one that is, that you qualify as the most best among all of them going to the developed world, because they have a stringent drug regulatory agency, more procedures and more investment must have gone into that process. So the ones that are going to Africa, right, uh, undergo through a lesser procedure and a lesser stringent procedure. So it's a concern globally, but
yeah,
someone has to take um, the lead in addressing this. I'll give you an instance. The African nations, some of them, not all of them, some of them are really, really handicapped. Their drug regulatory agencies is actually like 3 to 5 rooms in within the Ministry of Health.
yeah,
not well staffed. And if you look at it, you look at their budget for the entire national budget, including health, and you compare that budget with a county's budget
Yeah.
in the United States,
Yeah.
the one in the United States is more. So
Just the FDA budget itself would be the entire nation's budget in.
yeah, so they are handicapped. I think we should see ourselves first as human beings, right?
Yes.
And we should see ourselves as equals. And then what applies to Mr. A applies to Mr. B, irrespective of where you come from, right? So let's see ourselves as our brother's keeper.
Mhm.
But for some other African countries that have the manpower and the wherewithal to really fight this, yeah, yes, they can empower their drug regulatory agencies to engage these manufacturing companies to
Right.
stop this practice. It is wrong. It is unfair.
Right.
So I'll leave it like that because the answer to it cuts across technical answers and political answers. And to be candid, it's some of the answers are even emotional.
Yeah.
Yeah.
Chris, I think you're on mute.
Thank you, Ashwin. Thank you, Ashwin, and thank you, Michael. This is a thought provoking question and thought provoking answer. So, thank you for sharing this, Michael. So, as Ashwin discussed in the introduction, everyone has a role in ensuring medication safety, right? So, what are some of the simple action that public health policymakers and healthcare leaders can take to ensure medication safety? Michael, please.
Thank you. Well, we've all agreed that everyone is involved, but it's like we are taking a dive to look at each constituency now. For the public health policy makers, they are called policymakers, and then the program managers, they work around to provide funds to implement policies that have been made. So I would say simple actions is to deliberately, I use the word again, repeat, deliberately create an enabling environment by way of policy making to support medication safety programs at all levels, and then to equally make funds available to implement the policies. Policies should target reducing medication error, basically reporting and learning from medication error made in your local environment. There is no point discussing within your clinical meetings about errors made in India or made in the US or made in the UK. When you have lots of those errors being made at home, made in within your vicinity. So those should be reported and those should be discussed. There are so much lessons to learn from them. If you don't discuss it, well, nobody's going to learn from it. Policies again should be geared towards controlled access to prescription medicines. I mentioned earlier on that a place like United States, you can't just walk into a pharmacy and get prescription medicine, right? There should be deliberate policies, to control that. In the
Yeah.
developing world, you can go into a pharmacy and pick any prescription medicine. It's a function of buying and selling. Um, Policymakers, by the time they make some of these things mandatory deliberately, it becomes easy for everybody to work with. Again, some of these policies might already be existing, but when it comes to implementation or being enforced, it is weak, and that is because to enforce policies requires funding, deliberate allocation of budget to pursue a policy. Uh, Again, I'm a supply chain person when it comes to storage conditions. I mentioned before, if you, I mean, actually, I've equally seen it also. If
Yeah.
you go to see the storage conditions of medicines in some countries, it's really poor. Again, funding to maintain the storage conditions of these medicines so that the integrity is maintained, all through before it gets to the end user. And lastly, to empower drug regulatory agency so
Yeah.
as to be able to screen the medicines that are found within the circulation, within the country. That is very key. If health policies and makers and program managers can do this and create the funding for it to empower the implementation, that would be very great. It will go a long way.
Right. Thank you, Michael. And when you spoke about the regulatory affairs and regulatory body within the countries needs to be really strengthened, especially in the African subcontinent, sub-Saharan Africa. Now, um, this really, I'm curious to ask you. You have traveled around the world. If there is one or two actions, now we have covered Africa, one or two actions that maybe the Middle East region can take, because we see that in Middle East it's a different kind of a population there. They have certain advancements, but there is also some weaknesses in the maturity level of those countries. Now, there is a lot of many countries that fall into that category, even in Asia. You have Asia and that Middle East side of the world. I feel that they are neither too low but not too advanced also. What are some actions that those countries need to take to further advance and improve medication safety?
Again, we use the terminology developed and developing. Those
Yes.
countries you just mentioned now, they are within developing. What
Hmm, hmm.
is going on in Africa is equally going on in that region. So typically, um, I mean, if you've been there to those regions, you can easily get a prescription medicine in the pharmacy. You can without seeing the health care provider, right? Within that region, it's not terribly different. The
Right.
storage conditions of those medicines in those
Hmm.
regions is the same. Although some countries within the Middle East, yes, they have the manpower, they have the finance and the funding, and things are pretty going on well there. But the ones that I have been probably affected in the past by one disaster, man-made disaster or natural disaster, you know, or where humanitarian services have been carried out. It's like they are starting afresh from the very
Yeah.
beginning. And
Lebanon, for example.
yeah, and then during the heat of the disaster, the elites, the educated, they migrate their way to different countries. So they are starting afresh from the very beginning. So whatever challenge some African countries are going through is the same challenge they are going through. It's
Right.
effort that should be made, for medication safety has to be deliberate,
Right.
has to be formulated, has to be funded. The awareness needs to be there, right? So that's a quick answer to that. It's not terribly different.
Yeah. Yeah. And do you see a difference in the humanitarian versus development environments? Because humanitarian is more acute, and there seems to be always some level of sense of urgency to pass certain protocols and get the medicines to the public at need. Versus in development, there is some more time for folks to like strengthen the health systems, train the professionals. So, what is your opinion on waiving some of the important requirements during emergency response? How do you see that?
Well, the focus for humanitarian and developmental programs are similar, but they are different. One for the humanitarian, right? They are similar because it's assistance is coming from external factors, external stakeholders. That's why they are the same, but they are different because of the goal. The goal of humanitarian intervention is to
Mhm.
salvage the situation and not to make the situation get out of hand. So in doing that, um, I mean, there aren't any, how do I call it now, a mechanism to do thorough screening of
Yeah.
medications that flood that environment,
Mhm.
right? It is so we just solely rely on organizations and processes that have been put in place by WHO and all the stakeholders, that are working hand in hand with WHO, to make things happen. But again, the focus of humanitarian is to stop the degrading challenges in the
Right.
society that cuts across health, all manner of stuff, housing,
Yeah.
and all that, food, nutrition, and all that. So to stop that and then to start building it back. Now, between when you intervene with humanitarian intervention and
Mhm.
the time it gets stabilized to start, growing towards a development program, it's a function of how the country itself has taken ownership to drive the progress going forward.
Yeah. But
What we
they
have seen
usually forget after the humanitarian aid is given, they forget about development.
after humanitarian aid is given, right? Um, their source of livelihood, their source of wealth to to sustain the economy is affected. How long does it take for that to be stabilized? Now,
Mhm.
wearing clothes and just eating food, and then you go into one um, small hut and then come out and there's no more war, isn't enough.
Mhm.
It takes time. And in that journey, some countries are actually faster than others. So that's why the extent to which they take ownership and the funding or resources at their disposal will actually determine all that. We have seen situations where countries that had humanitarian issues, 5 years ago, they are still in that humanitarian situation. We have
Right.
seen some 7, 10 years ago, they are still in that humanitarian situation. So when does it stop? It's a function of when resources become available for the
Mhm.
indigens to take ownership of their economy. And that is, it's again, political answers come in there. I
Right.
only focus on the technical stuff.
Right. 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 That makes sense. Makes sense. Over to you, Chris.
Thank you, Michael. So, Michael, you discussed on the different actions that healthcare leaders can take to ensure medication safety. So, what are some simple steps patients or caregivers and general public can take to ensure medication safety?
Okay. Well, when it comes to the healthcare leaders, again, actions has to be deliberate and focused to institutionalize, medical safety program, across all the health institutions in your country, in a country or in a place, whether it's pharmacy and all that. But again, most importantly, this safety program must be anchored on reporting what is really happening, reporting on the medication error that is really happening in your locality.
Mhm.
If you have access to this error, aggregate them, analyze them, you will definitely see trend that is unique to your location, trend that is unique to your country, and then you that will inform the improvement strategies you put in place, right? They can insist also that medication uh, error is an agenda item to be discussed as most clinical meetings. There are clinical meetings going on in every health institution. Medication error should be an agenda in that meeting. And that what is going to be discussed is not error that is in a body of literature written in India or written in the US or written in the UK. Or it should be the one that is happening in our locality, right? Again, what the leaders can do is also to consider the workload on the part of the health workers. A typical health
Right.
worker resumes in the morning, and when they close, they are completely exhausted. If the workload is not considered, how do you expect them to do quality jobs? Right? Seeing lots of patients every day. Right? And again, they can also, as I actually mentioned earlier on, this continuous learning program can be incorporated um, to include medication safety in its curriculum. Some of them already have it, right? But again, um, that can be strengthened. Now, looking at the health worker, so for the patient, there are many health workers, interface with the patient with respect to medications and all that. But let's zoom in on three most important ones.
Mhm.
First is the prescriber, second is the nurse, and the third is the pharmacist. A prescriber, the simple things the prescriber can do, which they are already doing, they've been trained to do it. Let's use this as a way of to remind us. Review the patient case to understand the medication history. No assumption. Do a good review. And when you do a good review, you are likely going to prescribe the right medicines for that patient in the right dose. And whatever you have done, please document them, right? Electronically, it can be documented. Manually, it can be documented, depending on what you have in your system. Document them because other health worker will rely on what you have done to guide further actions. If you've done anything and you've not documented them, another health worker can continue the care after probably you are on leave or you have gone, you have closed for the day. I mean, it's going to start afresh. And then that will be duplication of, and that duplication can actually lead to
How the life.
duplication of medication, right? And if there are side effects, please discuss it with your patient. Discuss it with your patient and let them know what they should do. On the part of the nurse, right? The there are many medications today that have names that look alike, they even sound alike. Even when you see them, the color, they look alike again. Administration of the right medication is very key in the right dose at the right time when they are under your care, right? And even when in the right route of administration. I've seen a situation where IV, a medication was prescribed to be given IV, and it was given IM, intravenous for intramuscular.
Right.
It's very common, and vice versa, right? And also administering this medication to the right patient. Today, many patients have similar names. You have to cross-check the name with other form of identifier, such as the date of birth, medical records number, national ID number. In the US here, the social security, the last four digits of social security can be used, right? So don't just go with only the name, and please document what you have done, manually or electronically, because others will continue from where you have stopped. For the pharmacist, I say this: review the prescription. Go all out to see if there's going to be drug interaction and contraindication. It is your duty to do that. We have been trained to do that. This is just a wake up call, a reminder. Avoid dispensing incorrect medication, the dose or the dosage form. When 250 milligram of a particular medication is prescribed, please give that 250 milligram. Do not give 500 milligram and explain to the patient to break that tablet in two. Breaking that tablet in two cannot come out uniformly to be 250 in the two halves that you have in your hand. That is why we should have a check and balance system where after dispensing, somebody goes on to check what you have dispensed before handing over to the patient and then probably cancel the patient. I'll give you an instance. One of the mistakes I made in my early days. I was um, a pharmacist on duty in a neuropsychiatric hospital back in Africa. And as at that time, I'm talking about 25 years ago or even more than. As at that time, the medication that was very common, prescribed for, for patients in the hospital is chlorpromazine. We call it CPZ, an antipsychotic. I was on duty, and normally when chlorpromazine is prescribed, it goes along with benzosol, it goes along with other medications. Um, so all that combined together, you are giving chlorpromazine. But I received the prescription that contains chlorpheniramine. At this point in time, it was evening time. I'm completely exhausted. I just looked at it, and I went straight for the chlorpromazine, dispensed, labeled, and all that, counseled the patient. And I went back again to look. I already gave the patient has left. I went back to look what I have done. I realized I've dispensed the wrong medicine. So I rushed out. I was able to get the patient before the patient left the premise, brought the patient back, explained to the patient that I made an error. And of course, I corrected my error. So again, it is good for a second eye to look at what you have done. We are humans, and the energy we have at the beginning of the day is different from towards in the evening, because you would have used bulk of your energy and then you are completely exhausted. Again, considering the workload. When it comes to compounding medication, check your calculation again, especially the doses. Check them. Get
Right.
one eye to check. Do proper labeling of medication and counsel. Discuss side effect and what the patient should do if there is any side effect. Just to reiterate what the medical doctor have said again. So the medical doctor, the nurse, and the pharmacist have, as they interface with the patient, they have a lot to do in curbing a medication error, and then the patient will be better for it.
Thank you. We actually have a comment from the audience. So, the question is could you please comment on medication harm from alternate sources of medicine in the developed world? Recently, there was a case of white mulberry leaf related death of a US congressman's wife. So, the person is asking about the alternate sources of medicine, traditional medicines, and other ones.
Um, which country was that again?
Here in the US.
Okay, so that's to tell you there are always alternative routes in even in developed world, right? So the thing is, when a patient is on prescribed medicines and then they go all out to go and get alternative medicines, most times they use them together without letting the health worker know that they are
Oh,
using
yes.
them together.
Yep.
And depending on the uh, herbal medicines you are taking, it does two things. First, it's either it will inhibit the enzyme. I'm going technical now, right? It will inhibit the enzyme, right, that metabolizes the prescribed medicine. In other words, it stops the natural enzyme that would have acted on the prescribed medicine. And when you stop that, the level, the dose of the prescribed medicine will increase in your body, because the normal enzyme that is meant to metabolize it is not metabolizing it. And with that, the next day you take the same medicine again and you take the same herbal stuff again. So what you have in the end will be an adverse drug reaction from the prescribed medicine. Also, some herbal medicines can uh, increase the metabolism, not inhibit this time.
Yeah. Wow.
Yeah,
Yeah. That could also have a.
it can increase the metabolism. So when a good example, let me not. So people that take alcohol with medicine, it's completely wrong.
Yeah.
Most of the time, the alcohol increases the metabolism of those drugs. And if the drug was meant to last for 8 hours, for you to get the benefit, it might last for 4 hours, because you have just increased the metabolism of that medication. And the condition, gets worse over time. And before you know it, the person lands up in the hospital as emergency case. If the depending on the country where you are, if the equipments are not there to resuscitate you, the person is gone.
Right.
So that's why for the medical doctor, when they do a review, of a case, they ask questions over and over again. Which medicines are you taking? Can you bring them? We encourage you to bring them to the hospital, bring them to see your healthcare provider for them to see. And then they ask you, are you taking other medication? Right?
Right.
Out of care, our loved ones, our relatives, cousins, they come up with some herbal medicines or even some other agents that the people, their friends or their relatives can take. It is out
Right.
of care they are doing it. We are not saying don't do that, but please, why not double check with your healthcare provider?
Be transparent with yeah,
Yeah,
I think, yeah, being transparent with health workers, one key thing people and public can do when interacting and getting healthcare. That's a major point. Thanks.
yeah.
Over to you, Chris.
Thanks. Thank you, Ashwin. Thank you, Michael. So my next question is: how can medication safety be ensured during transition of care between health teams?
Between health teams, okay. Um, I will speak broadly, right? If it is within health teams in the same facility, a proper handover should be done.
Hmm.
A proper handover should be done, and hand proper should deliberately be um, implemented in such a way that there is an overlap of time between shifts, so that the team that is coming to take over the care of the patient and the one that is taking care of the patient that is leaving will have few hours together, right, to do some debriefing exercise about the patient that is under their care. It is very key. And for whether the health worker that is leaving or the one that is coming, they have been trained to do this, right? To document observation and their actions, manually or electronically, in the patient's case file. So with that overlap, you know, deliberately formulated, because we have a situation in where some countries have that good overlap, at least a minimum of 1 hour between the incoming and the outgoing care provider, whether on the medical
Yeah.
side and all that, 1 hour or 2 hours overlap. We have some that, hey, there's no overlap at all. And the team member that is resuming to continue from where the one that just left to continue, sometimes if things are not well documented, you throw the person off balance and the person can even start the process afresh again. Starting
Yeah.
the process afresh again implies duplication of effort or duplication of medication and all that. Then coming again to if it's between healthcare team of one health facility and another health facility, medication reconciliation. This is very key. You're comparing what the patient is taking and what was prescribed. This will help the recipient facility to act and plan better. In the process of doing medication reconciliation, you are assessing the patient if the patient has been compliant, right? Taking its medication. And whatever your findings are, in a polite manner, is documented manually or electronically. This is the essence of this is to see if there's any red flag so as to communicate that red flag amongst all healthcare teams. That
Definitely.
way, right, the transition will be better. So a very key important message here is that proper handover or medication reconciliation should be done in such a way that it flows with the routine of the work in any health facility. it shouldn't be seen as a new task or a standalone activity. It should be within the routine workflow of any facility. If in this transition discussion, the only constant here, right, is actually the patient.
Yeah,
The former team that was taking care of them will leave, a new team will come, and with time, that the constant thing here is the patient. So the
the
patient
patient.
should be actively involved, should be actively involved by giving accurate information, during the medication reconciliation. So with those active and with involvement and to give accurate information, we help the healthcare teams during transition.
This is quite an important area, Michael, and it's critical that health organizations need to develop quality SOPs and manuals to ensure that these things are happening standardized way, and there's reconciliation of SOPs between health teams as well if it's a totally different organization. And to your point, Michael, when you spoke about individual patients and how they need to be transparent with their health workers, we actually have an audience question. This is actually coming from Dr. Campbell. His question is: excellent presentation, Dr. Egharevba. In addition to grapefruits, what other foods reduce, increase, or block medication metabolism?
Grapefruit is one of them. Thanks, you mentioned that. There are a lot of them. I cannot think of any now, but the one I normally give a sample for is that the grapefruit you just mentioned. So if you go online and go, you will see lots of them.
Yeah.
You will see lots of them. I am not in active practice, but I know these things. So that's a good question. Actually, we can get back to him later with
Sure.
lots of other food that can
Yes.
interact with medications.
And also, yes, as Dr. Egharevba said, the alcohol plays a huge role in terms of food, and plus it is mostly and most of the time is perhaps medication specific, also based on what medicines that particular person is taking, and that could also have an effect. Over to you, Chris.
Thanks, Ashwin. So, so the next one is thank you, Michael, and thank you, everyone. Next week we will have Gayatri Muthukrishnan, who is a science communicator and a women's health advocate, and she will be talking about her journey on women's health. So please stay tuned. To you, Ashwin.
Thank you, Chris and Michael. Thank you so much for coming to our channel today. This was quite informative and quite an engaging conversation today. And just want to conclude the program with a pledge that WHO encourages each one of us to take. And this really resonates with the important point that Michael had made about taking accountability for our own health by being transparent to the healthcare worker. So, this is how the WHO pledge goes. On World Patient Safety Day 2022, I pledge to improve medication safety by, there are 5 points here: actively engaging in my medical treatment, knowing my medications, checking that I'm taking my medications in the right dose at the right time through the right route, asking my health worker when in doubt, using medication as intended, and encouraging my friends and family to do the same. And I will play my part in achieving medications without harm. So, thank you once again, Michael, for this informative conversation. And we hope to have you again as part of a panel or a program in the upcoming series. And is there any handles that people can use to reach out to you?
Definitely. If you go to LinkedIn, my email is there. Please feel free to send me any message. A last message to to patients, which I think is important, especially any part of the world that you are in. When if you're not comfortable with any healthcare worker, please change him. Just move on to another. You need to be comfortable with the healthcare worker that listens to you, that you feel understands you. That way you get the best. If any health worker is coming with any attitude and it's not palatable with you, please, you have the right to change the healthcare worker. Thank you.
Thank you, Michael. Thank you. That's a very good point to end our program. And everyone here in the US and around the world, have a great weekend. And we will see you next week with a new program. Bye bye.